Hi guys, welcome back. If you're new around here, my name is Kweku and I am a pharmacist. Today I'm briefly going to be reviewing the medication Lyrica, also goes by the chemical name Pregabalin. We will take a look at its uses, some side effects. We would also definitely take a look at some precautions or best practices to be aware of while you take Lyrica. Quick reminder that this video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So Lyrica or Pregabalin is a medication that is used to treat nerve pain that is associated with diabetes, or what we normally call diabetic neuropathy. It is also approved to manage pain that is caused by spinal cord injury. Lyrica is also used to manage a very painful condition called postoperative neuralgia, which is a very painful condition that affects the nerve fibers and also the skin. This is typically a complication of usually shingles. The person may recover from the shingles all right, but they may be damaged to some of the nerves, resulting in excruciating pain. And a lot of the times, Lyrica may be prescribed to handle that kind of pain. Lyrica or Pregabalin is also approved in the management of fibromyalgia, as well as an adjunctive therapy for some kind of seizures. And when we say adjunctive therapy, that means that it may not by itself be used to manage those types of seizures, but it may be used as an add-on to the regular seizure medications. Lyrica also has a few off-label uses, and off-label uses are uses for which they are not necessarily approved by the FDA, but over time they realize that it works for those conditions, and as such they are employed in those conditions. So for example, it may be used to manage anxiety. It may also even be used in post-operative pain or restless leg syndrome. Lyrica may also be given to manage itching that is associated with chronic kidney disease, a condition called uremic pruritus. With respect to side effects, I have grouped them into the various body parts that they affect just for ease of remembering. So the gastrointestinal side effects include constipation, nausea, and xerostomia, which is dry mouth. And you can see from the percentages that dry mouth accounts for the bulk of the gastrointestinal side effects. Approximately 1 in 10 people taking Lyrica or Pregabalin may experience some kind of dry mouth. The next group is what has been classified as the neurologic side effects, and this includes dizziness, accounting for about 17 to about 32%. So that's quite a significant number of people that experience dizziness while taking Lyrica. And then we have headache, and also quite frequently reported is somnolence, which is sleepiness or drowsiness, usually for prolonged periods of time, accounting for about 11.4% to about 35.7%. Incoordination or lack of coordination has also been reported, as well as ataxia, accounting for about 3% to about 15%. Now, ataxia is a condition that makes the person look like he or she is drunk. It's characterized by slurred speech, stumbling, sometimes even falling. Lyrica or Pregabalin has also been associated with asthenia in about 5 to 10% of the population. Asthenia is a situation where there is abnormal physical weakness or lack of energy, feeling lethargic all the time. Then we have what they call the metabolic side effects, and key among them is increased appetite, which obviously leads to weight gain in about 2.5 to 12% of the people that take Lyrica. And then some other miscellaneous side effects: peripheral edema, which is fluid accumulation or fluid retention; euphoria in about 2% to 6% of the population. And because of this euphoria, there is a potential for dependence on Lyrica, and I'll talk about that when we talk about the precautions. But because of that, Lyrica is also a controlled substance here in the United States. Fatigue, as well as other side effects. There's quite a few of them. Obviously, this is not an exhaustive list. As you can tell by the number of potential side effects, there definitely is a need to take some precautions or have some best practices in place when you take Lyrica. As mentioned already, Pregabalin or Lyrica may cause physical and psychological dependence, and therefore it must be used with caution in people who have a known or suspected history of substance abuse. So if you are prescribed Lyrica, as much as possible, try and stay within the dose that has been prescribed for you. And if you have a family member like a kid that is prescribed Lyrica, it would definitely be a good idea to keep a close eye, support that person, help that person, just to make sure that that person is staying within the dosing guidelines. Also, as discussed earlier, Pregabalin or Lyrica is known to cause dizziness and drowsiness or sedation, something we refer to as CNS depression. It is not recommended to drive or operate machinery or perform tasks that require that you are mentally alert until you know how it actually affects you. For this reason also, Lyrica should not be used concurrently with alcohol because it has the potential to cause additive drowsiness, or it can potentiate the drowsiness effect. This is also true for other sedating medications like opioids, hydrocodone, oxycodone, and benzodiazepines like Xanax, alprazolam, lorazepam, diazepam. Now, when these are taken concurrently with Lyrica, they definitely increase the risk of this CNS depression. And some CNS depression may be manifested not only in the drowsiness and the dizziness, but it can also lead to respiratory depression or breathing problems. So especially if you have an underlying problem, you have COPD or other underlying breathing issues, definitely be very careful when you combine Lyrica with some of these medications. I must say here that they are not absolutely contraindicated. That means that it's not that they can never ever be taken together, but typically caution should be exercised if they are to be taken together. Lyrica has also in some instances been associated with suicidal ideations and thoughts, and therefore if you are prescribed Lyrica, definitely be on the lookout. Watch out for any worsening depression, any suicidal thoughts or behavior, or any unusual changes in mood. This is especially true if you are the caregiver. It's usually easier to monitor somebody else. So if you are the caregiver, especially for children, definitely be a good idea to keep an eye on them, make sure everything is going as you expect. Lyrica or Pregabalin should also not be discontinued abruptly. This is because when it is discontinued abruptly, it leads to an increase in the risk for withdrawal seizures or certain adverse effects such as insomnia, nausea, headache, and anxiety. These are all been things that have been documented when people have gotten off Lyrica too quickly. Best practice is typically a gradual dose tapering where you reduce the dose gradually, typically over a minimum of 1 week, so at least 1 week. So that's a high-level overview of Lyrica. I hope you found some value in it. If you did, please consider giving it a thumbs up or liking this video, sharing it, and most importantly, consider subscribing to the channel as well. Thank you for watching. I will catch you on the next video.